All right. Well, hello and welcome to everyone to another Intersex Human Rights Australia webinar. Today is, of course, Intersex Day of Solidarity, marking the birthday of Herculine Barbin. We posted a very little bit of information about that on Facebook today, but we won't get too deep into that. Um, on Intersex Day of Solidarity, we see it as a real opportunity for allies to step up, and with the recent Darling Award being given to Working It Out, we thought this would be a great vehicle to have a conversation about allyship. So today we have Simone Lisa Anderson, who I'll introduce in a moment. But before we get into that, I'd just like to pay my respects. I'm calling in from Ngunnawal country today, and I invite anyone to recognise the traditional custodians of where they're calling in today. I'd like to pay my respects to their enduring connection to country, community, and culture with gratitude to their elders. It is an act of rebellion against ongoing genocide in our country, and it's my goal to be a participant to truth telling and reconciliation. Simone Lisa Anderson is an accomplished educator who has facilitated learning from young people to adults in a wide range of formats, from the pedagogy of science to classroom facilitation to intersex education. She is also a staunch intersex advocate, interacting with all levels of government, from government steering committees to MP discussions, advocacy, and legislative change through to supporting other jurisdictions in legislative change. Currently, Simone Lisa is creating Change Through the Better Lives project, a follow-up to the pilot Better Lives Midwifery, which facilitates education to the Tasmanian Health and Education departments on the needs of the intersex community. She also facilitates an intersex peer support group and is a co-researcher with the Interlink program. Very excited to have you here tonight, Simone Lisa. How are you doing?
Just great. It's been a beautiful day here in I can't even pronounce it now. um, I can see it in my head, so I'm just going to say Hobart. Uh, Nipaluna. Nope. Yep. I've just been told yes, I got it correctly.
Fantastic.
And I say it every time I do a presentation or a facilitator workshop. Yet tonight, here, right now, I was unable to do that. It's been beautiful here today. We've had a 25-degree heat wave, and I'm wearing a t-shirt, which is unheard of at this stage of summer.
North of the Antarctic. Um,
Slightly north of the Antarctic. Um, yes. So, first of all, I'd just like to show everyone the amazing award.
that's the Darling, which
This
was awarded
is
to
the
Working.
Darling.
Would you like to tell us a little bit about Working It Out?
Oh, right. So Working It Out has was created about 27 years ago in response to a lack of an organisation that supported the LGBTIQ plus community. It started in the Northwest and came down to Hobart about 3.5 years ago. We had a new CEO called Lynn Jarvis, and Lynn noticed that there was a severe deficit right through not only the community but voices from the intersex community, from um, state government right through. And so she took a journey to find someone, and she found me to not only be that voice, but to take the voices of people from the intersex community to be heard. And from that, they've just been an amazing ally, which is incredible because whatever I need, I get. And I don't know if anyone else can really say that, but I'm sure there's lots of questions you're going to ask me, and I can explain a little bit more about what that means.
Fantastic. Yeah, we've certainly gone over some of your bona fides in the in your little introductory paragraph. Thank you for providing that. I guess what's more of your personal connection to the intersex community? Like,
Oh, oh,
what inspires you to do this work?
well, I do have a story. I'm not quite sure how much I've said before, But basically, my middle child was born with an observable variation of sex characteristics, and then he was observed again just after his 18th birthday with another variation, and because of that, I have become a staunch advocate. I was one of those parents that decided bodily autonomy for the child was more important than anyone standing over me with a white coat, which I think is has been, at the time, I was just angry and didn't want anyone to touch my child because it's my kid's body, not theirs. And my child has had a very, very different upbringing to so many of the people that I've heard their stories of from the intersex community. Um, and because of that, I want to make sure that the stories I hear aren't repeated by younger and younger people. And so I started off as a mother that wanted to make sure that other people didn't get a raw deal. And now, as I've worked and I've spent more time with a wide range of people from the community, and I've done so much research, and I've seen what can be done around the world, and I've seen how change can impact and make better outcomes for the community. And at the moment, my head's thinking systemically as well as foundationally, and it's really difficult to try and verbalize all of those. So at a foundation level, um, I'm seeing the people that I support here in Tasmania have better outcomes in the health department. And systemically, I can see that policy and procedure um, in the whole of government is actually changing because of the voice that I've given the community. So I know you asked me, what is my connection? But it started, you know, very small, and a jumping up and down mother going, "You will not do this," through to someone that gives a voice to others, as well as my own voice and my own thoughts and opinions, which are based on what the community needs
Yeah,
and wants.
I think it's absolutely incredible, actually. I think you're such an asset to the community in terms of providing that parental experience and just in terms of helping informing our advocacy from those perspectives as well. Um, and yeah, it really is a process of like trying to change the story for so many people who've had like difficult experiences. But
Hmm.
I guess like where I want to take the conversation now is what is the importance of allyship to that process? Like, well, what does allyship do for your advocacy?
Well, being an ally, when you look at it, it means that I am separate from the community that I represent. And because of that, I can I can remove barriers through my voice that I've been given. And that voice is heard, which continually amazes me considering there's way better voices in the community than my own. But I've found that being a parent, I'm more likely to be heard. And I have that platform which removes barriers that challenge basic human rights that the intersex community um, may not be have available to them. And it also supports, I've got my notes over here, so it also supports equality access and the ability to thrive in a society. I'm giving a voice for that to happen. And by surviving and thriving in a society, I mean changing policy and procedure in government departments, and right down to the community nurses and the support teachers in schools to be able to give what needs to be given for the issues that the community has that need to be addressed.
In a
Okay.
sense, you have a community that spends energy, and it's the role of the ally to multiply what that energy can do.
Well, yes, and direct it to where it needs to be directed. I've got quite a few people in the community that I support down here who want to have a voice, and I want to give them that voice, and so I take what they want to happen in Tasmania, and I put that voice forward. And by doing that, I'm supporting them to be able to have that voice. But I'm also giving them a chance to see how that how that happens and how that works, so
Mm.
then they too can have that voice when they're ready to step up.
I think I guess it's not just about I mean, I wouldn't even consider your work necessarily that as an ally to the community. You feel very integral to the community, but
I do.
the work that you do is actually supported by this organization, working it out.
Mm.
So I guess what makes working it out an effective ally?
Okay, so I have a list,
Dot points. We
but
like dot
I have
points.
yeah, it's completely dot pointed. But the main thing, they give me everything I need to be an effective advocate. And what that means is that they've given me key introductions, they've given me seats at tables so then our voice can be heard. By introducing me to key people in different departments, by introducing me to key people in primary health, HR departments, I've been given entry to talking to people that make change, who support the community and their needs. And being having that voice and being able to do that means that change happens quicker, it happens faster, it happens effectively, all because working it out has given me, I mean, that they've given me this office, that a laptop, everything I need, as well as supports to have chairs at tables, which otherwise I wouldn't get. Um, that's what they're giving me to do my work, and they also don't take a management fee for everything that they do for me. So I have a grant from, oh sorry, Working It Out has a grant from the Tasmanian Community Fund, and not only did Working It Out support me and do most of the work to get that grant through the application, they have not taken any money at all for any fees to do the consultation work to make that happen. They don't take any management fees for me to, to support me, to mentor me, to do everything that I need to do my job to support the intersex community. I mean, yes, I pay for the bit of internet that I take and the little bit of electricity I take, but that's it. And I think that's a really great thing for an ally to do. But what else do they do as an ally for the intersex community? Well, they listen and consult with the community. So when something comes up, for example, just recently we had the Justice Department put together a framework to be inclusive, which will be used right throughout the whole government. The intersex part, I was consulted on that. And I said, well, I don't like how it's written. This is how it should be written, which would be inclusive and appropriate, because the way you're writing it here only only takes in a very, very small percentage of the intersex community. By writing it this way, it takes in holistically the whole community. And that was taken on board and put into that framework. And with the consultation, with the grant that I've got now, I actually have a budget to pay intersex people for their knowledge. So people that have the knowledge that are in the community, I actually pay them um,
Mm.
a consultation fee, which is great. What else? They've researched how the community wants to be seen and heard. So anything that I've read, I send on to different people in the organisation and they read it too. So then they're over new research that's come out. They commiserate when we read horrible things about this is how long a penis should be, which is not really appropriate. But we make sure that, well, I make sure that Working It Out has a holistic understanding and reference point with the research that's done. As I said, they've made sure that the community's voice is there when decisions are made for the LGBTIQ plus community, and that the community has had a voice to be part of that decision-making process. So not only have a voice saying, well, okay, we've heard what you say, this is the decision we've made. But not only that, but having, well, what do we need? What type of decisions need to be made? So I've had that voice there as well. And I know for a fact that quite a few of the advocates that are in tonight's meeting, tonight's webinar, have been asked at numerous times to give consultation and knowledge for working it out, to be able to support the community. They've encouraged. Oh, sorry, I haven't finished yet. There's lots to say. Lots to say. They've encouraged state departments to engage in intersex education, which in turn creates new allies. By the way, that I do the because I do all of the intersex education in working it out. So all of the departments that I've done intersex education on, and I call it one-on-one, 101 intersex. And the way that I do that creates allyship and creates allies, and not just allies that are seen to be doing something, but allies that are actually doing something by changing policy and procedure to make things more supportive. I've actually written here on my note that they were very sneaky about that. I've actually written sneaky fuckers, but I wasn't supposed to say that. So they're so not just performative allyship, but upstander allyship, if you know the difference between that. Okay. And they've learned about the issues in the community and have updated their actual learning packages to support those issues. So every package that Working It Out facilitates, they've updated all of that. We spend quite some time looking at all of the packages that they present and facilitate, and make sure that that intersex aspect is appropriate for now, and is actually supportive, and not just what's that word I used before? Performative allyship. It's actually upstander allyship. And they employ an effective intersex advocate and pays for community consultation. So there you go. That's why they're a good ally.
So you're really describing like a very fundamentally symbiotic environment, because I know when I was starting off in advocacy, the most I got from people was that, so like creating resources and connections and creating the environment where the work was sustainable. But then your organization then gets to benefit from the sustainability of that work, because you got that competency building, you got that capacity building, and basically any inroads that you then get to make as a result of your expanded capacity within the organization has this knock-on effect of creating resources for the intersex community.
And any resource that is created during the Better Lives program, which I'll talk about later, is actually free for the intersex community and intersex organizations to use. So there's no paywall, there's no, oh, you've got to give us some money or anything. And I'll give you an example. Agenda in ACT actually has been given this. And this is a Australian First booklet that was written by probably, I don't think you can read that, but several of the people that are on here today. And they've actually got this and printed it out for people in the ACT. It's for families that have just got a brand new baby that might have a variation of sex characteristics. So it's brilliant, and it brings together several resources. But that's free, and people can download that and use it in their own organisations. And this was completely paid for by the Tasmanian government for the last grant that Working It Out and IPSA got for the pilot program of Better Lives.
I feel like your answer to the last question was so thorough, but just to make sure that we don't...
I've got more stuff.
Yeah, just so we don't skip over anything. So, like, can you think of any other ways that Working It Out supports, how they will support your work directly?
Directly if I need any mentoring to be able to get myself up to scratch with not only legislation but knowledge needed to how policy and procedure work in a variety of places, so I can actually consult. I'm given it. I'm given time to research. I'm given time to spend with people like yourself, Cody, so then I can stay and have an up-to-date voice for the intersex community, and that's something I cannot say many other organisations let you have Facebook open on your browser as well as Messenger and are paying you to talk to people. So I'm very very lucky that I'm given that opportunity to do so. But I'm actually encouraged to make sure that I keep the connections to the wider intersex community open. And I talk to a lot of people. What else do they do? If there is an issue with anything that has to do with the intersex community, um, the CEO of Working It Out makes sure that I have a seat to that issue. The CEO is a chair on numerous government departments and also is consulted for anything LGBTIQ plus here in Tasmania from the government down because of her connections. So if there's anything to do with even one community member that there's an issue, I get asked to consult on that. And that happens all the time. Not just the one, but we're looking at this. What is that? And if I can't help or they want extra oomph to what they're doing, and that includes other advocates of the acronym, then I'll suggest somebody else like Morgan or Bonnie or Cody of late. So then we can make sure that the intersex community here is supported in I don't know, the best way possible. I mean, if you're talking to the best of the best that are here in Australia, then we're going to get the best of the best in our policy, procedure, and legislation. And that's what I want to support. So that's what they do to support me to make sure that I can continue connections, which I think are important for me to have. I don't know if that sort of answers the question, hopefully.
Yeah, I mean, I think you're giving some. I think you're bringing your A game tonight. To be honest, I'm also like thinking in terms of like just having the structure of a workplace, having co-workers and all that. Just can creates like a better environment just to get work done. Um,
Yeah.
I, so yeah, we talked about how your work is supported directly, but I guess what are some of the initiatives that Working It Out supports that supports the broader intersex community? Like, looking, I guess, more nationally. Like, you talked about sort of funding opportunities for consultation, but
Yeah. Okay, so when I'm asked to go on to consult groups, um, I'm actually given the time to do that. So I'm paid to do that. And I'm talking nationally and internationally. I was given a seat at a table for New Zealand roundtable looking at how they were going to support their legislation moving forward. It was just a workshop, and I was paid to do that. So then my voice could be heard. And that's what they do consistently. When we're talking about the resources, anyone, any organisation, anywhere can ask for any of the resources we've created in the Better Lives program. And there'll be 3 more of these very shortly for different age groups. As well as the packages, the learning packages, the whole learning packages are free. So anyone in Australia can go, hey, can we have a look at that? Sure. Once I've finished actually presenting that, I'll show you how to present it, and then you can use it. I believe Yellow Tick will be picking up most of those packages as well. So then, it's fantastic that working it out is supporting other organisations that are intersex or intersex organisations with with what can be created out of the grants that we have.
Mm.
Mm, mm. Um, I've written just basically about the resources. Oh, and someone here has written working out direct support workers. Oh, working out direct support workers are available to intersex people for consultations. And what else we do is that I don't know if any of you understand or have heard of this, but this is a national program and it's called Interlink, and it is amazing. And we also promote this whenever we're doing facilitating workshops. We take these with us, and for anyone that might have someone that has a variation of sex characteristics that needs support. So that is another thing that Working It Out does. If there is a program or something that needs support and needs participants, Working It Out will do that performative allyship by putting it up on their website or Facebook page and go, hey, look at this. But also that they'll do the work and try and support as many other intersex organisations and their work as well.
And just to, I guess, further explore, like we talked a lot about what Working It Out does for the intersex community, but what does Working It Out, what benefit do they get from being an intersex ally?
They get to put the I in their little blurb.
Mm.
Mm.
I see, like you said, it comes back to that idea of performative allyship, where we see a lot of LGBTIQ organizations absorb the resources to do ostensibly intersex work, but it doesn't actually translate into intersex work.
Mm.
Yeah.
Well, I think Working It Out is doing a lot of intersex work
Yeah.
here in the state, and they're taking nothing for it except being able to use the I in their blurb, and I think that's really, really good allyship, because it's not about taking, it's about giving,
Mm.
and that's what I think allyship is all about.
We've touched on the Better Lives Project a couple of times already, but
Yes.
I guess here's your big chance to talk about any and all projects that have your attention at the moment. So the question we have here written out: what sorts of projects are you enabled to do through Ally resources that you would struggle to do otherwise?
Okay, so our Department of Health have been working on learning modules for inclusivity. Yeah, I know, right? It's been really cool. So I've actually got to consult in that whole process. So when you become an employee of the Department of Health down here, there are a number of modules that you need to do as part of your getting in orientation, and and they've made sure that the inclusivity modules are necessary for them to actually work in the Department of Health. So I've done quite a lot of work through that. So I suppose I've consulted with the Department of Health to be more inclusive with their inclusivity modules, right from looking at language and how language is used. I've actually got a little bit of me in a video. I don't look like me because they put me in a chair and put makeup on me, which is really scary, but apparently it looked okay. I had caterpillars. It was wonderful. What else do? I do whole of government consultation. So down here in Tasmania, every 5 years or so, we do a a survey that creates a framework for the next 5 years. This survey, we had someone called Ange Dwyer, who is a UTAS researcher that created that, and I think we got the highest amount of people from the acronym to actually be a part of that survey that they've ever seen here in Australia, which is really great and exciting. I think they had to do like a statistical thing per population or whatever, but that's what they claimed. Anyway, the thing is that with that survey, they needed someone that can consult to make sure that the language was used appropriately and using inclusive language, especially when it came down to the intersex questions. So I actually spent that time creating relationships with ERA and other people to make sure that I knew the language. And this was one of the really, really very first projects that I did, which was a learning curve. And I still think about that project because we did so well with the language that was used there, and are able to actually make from the data collected, make specific goals for the intersex community for the whole of government to make. So that's been a 2.5 year process. I know it's supposed to happen every
Things
5
quickly
years.
in this space.
Nothing moves quickly. So that was a really cool project. Now, I wouldn't have been able to do this without the support, not only of the intersex community, but groups like Working It Out and Equality Tasmania. Now, also, every time that there is a research survey that's being created here in Tasmania, I get to consult on that. So I'm called or emailed quite consistently, asked to look at language, which I just follow the standard. And because a lot of people can't read the standard and think, oh, okay, I just write born with, and it's just like, well, no, if you read the notes, it actually doesn't. It says you're only going to get a small section of the data that you actually are asking for. Perhaps you'd like to write it this way instead. And so I get a lot of buy-in that way, and it's really great to see the finished products of the surveys that I'm supporting with, and the outcomes that occur because of those surveys. The last one I did was for Clinic 60, and that's a gender clinic. And you think, well, not every, well, just like every percentage of every population, there are transgender people in every population group, and so we wanted to make sure that every group that would have a population of transgender people in it were supported in an inclusive space with the gender clinics. So that was really good.
Gender clinics are also typically guardians of gender affirmation guidelines,
That's
and
right.
there are
Yes.
intersex people who seek out gender affirmation not necessarily because like on the basis of them being intersex, not on the basis of being transgender either. So
Yes.
I imagine there's an
I was
opportunity
getting
to
that.
influence policy with that.
Yeah. Yes, and I have influenced policy that way because um, I have two young people. One of them's 30, and one of them's 27. And the other one's almost 23, which is really great. They're still my young people, even though they're probably more adult-like than I am. And I have one that has gender-affirming needs, and I have another one that has gender-affirming needs. And one has a variation of sex characteristics, and the other one is transgender. So I do understand the difference. And with that particular survey, we were exploring quite a number of different things, but just making sure that people that have a variation of sex characteristics weren't excluded because of their variation of sex characteristics, where if they were trying to change the gender that they were observed of at birth. So anyway, okay, moving forward. Also media. Without ally resources, a lot of the projects that I have supported, and one of the projects is actually changing legislation. There are so many media outlets here that I have allies in, and that are allies to the intersex community. If I need something to be out, I mean, just Google my name. You'll see all of the articles. You'll see everything that has been written, because it needs to be written to support the change that I want to happen. That's going to be a good outcome for the intersex community. So legislation is a really big project I've been working on for a number of years, just like everyone else has for a number of years. It's great. Okay, so what else? So with media, having allies there is fantastic. On my phone, I've got people like, what do you call them? Media, and they've got names because I name people on my phone just like everyone else does, but it goes ABC radio person, and so forth. And there are so many of them which I can just ring and say, hey, this is happening. Can we have a minute of your time? I spent 2 weeks ago an hour on community radio, which was fantastic, talking about how to be a great ally and also what Working It Out does. So that was a whole hour of people in a rural area hearing all about intersex. And we had some really great support during that time from people ringing in. So that was really good.
I'll have to make sure we link that on the page when this goes up.
Okay. And the Better Lives Project, that has been a major focus of my life for the last few years. What it does is just incredible. We did a pilot last year, and we did it on a shoestring budget of 25 grand for 12 months. Very, very shoestring. And we, we created things like this, you know. And what that program was, we spent a lot of time with research thinking, if there was just one profession that would make the most change in the intersex community, who would it be? Anyone that has to guess?
I mean, I already know the answer. Is it cheating?
Yeah, no, it's not cheating. It's answering the question.
I mean, yeah, we got midwives, we got doctors, we got people who are there at the birth.
So yeah, we chose midwives. Easiest people to talk to. Doctors aren't that great to talk to. I don't know if anyone else has noticed that. Some are wonderful. We've got some amazing allies here in Working It Out who are doctors, but we decided midwives. And so I created and wrote a professional learning package for midwives and rolled it out Tasmania-wide during the pandemic, which was fun. And because of that, I'm finishing off the Southern Midwives next week. That's professionally developing them, not finishing them off in some way that's inappropriate. Just letting you know. Okay, so and what that does, it's an hour-long professional learning time education where people are introduced, or midwives introduced to the Darlington Statement, and also introduced to language, historically based language and current language. So then they could make links with language that they may or may not already have, and then be able to see what would be a better way of, or a more human rights-y way of supporting people with variations of sex characteristics, how to observe variations of sex characteristics in the delivery room, and how to act, what actions to have in a delivery room to support that baby, to make sure that baby has a positive birth and a positive start to life. And I think that that has actually worked really, really well.
Mm.
I've got many, many stories from what the midwives have said to me after the presentations, and all of them have been very, very positive. Some of them wishing I'd done that earlier, or that they'd had an opportunity to hear about how to support families earlier. Every single one of them took many of these. So every hospital in Tasmania has these to be able to hand out to parents, new parents, and that just supports a parent for the first few days. The questions, how to find information, and it's also quite supportive. So that's great. So from that, we had such a buy-in from other professionals. So I had social workers that would pop in and just, pretend I'm not here, with the midwives, and go, "You need to come and teach us about this. We need this education." And then I'd have pediatric nurses that would do the same, and they go, "You need to come here and give us that knowledge, because we need that knowledge." And the need was so great, right through from community nurses through to GPs. It's just like, I've had so many GPs that are allies that go, "Well, I just don't have that knowledge base. Can you come and give that to us?" As well as through education, the ACT, not the ACT, Agenda Agenda, Cody, Gabrielle made an amazing resource, an educational resource, which I fell in love with. And I thought, this needs to be implemented. This needs to happen. And it needs to happen in a place where it's going to be easy to implement. And so I decided to do that here in Tasmania. And that's what I'm doing. So I'm creating professional learning packages not only for health, and that's GPs, school nurses, community nurses, pediatric nurses, but also school support officers, social workers and psychologists, childcare workers, and early childhood educators. And I'm creating professional learning packages for all of them, so then our community can be supported from birth right through.
Yeah, the way I like to explain this to people is that the violence that happens to the intersex community really does happen in the absence of knowledge. It's like,
Yeah, it does.
it's not just an absence of knowledge. It's a vacuum. Like, people are actually hungry to understand what the issues are, but it's sort of like, again, it's just like, when we're a community that's found like foundationally dealing with trauma and hurt and repair and healing, it's very, very difficult for the community to direct those resources outwards at times. So I think
That's right.
one of the really exciting things about working it out is that you're building this community competency, but it really is changing the environment in which violence happens to intersex people.
Well, the other thing is, when we look at the Darlington Statement, it states, the community isn't here to educate you. It says that, in other words, but I'm just paraphrasing. So by me educating all of those people in health, it means that that person from the community can go to their healthcare provider. They don't have to educate. They don't. Well, maybe a little bit, but not to the point where it's a novelty of some sort, just like some people that have weird and wonderful diseases like I have. It's a novelty. It says, "Oh, let's spend your 15 minutes that you have before my next appointment telling me about your awesome issue with your blood." Just great. And so by having these resources, having these professional learning packages means that you get to deal, or somebody that's in the community gets to deal with that healthcare worker or that teacher or wherever they are, with the issue that they're presenting with, and not with the need to educate. And also by creating these professional learning packages and rolling them out, it means they know who to go to if they've got questions, which means that their client that they're working with can have that an ally in that doctor, in that nurse, who's going to go and do the research, because I've been told, hey, it's better that you go and do your own research instead of asking your client the ins and outs of their genitalia when they're coming for a broken arm. Yeah, so
Self-advocacy takes self-awareness, and
that's right.
fundamentally, like, you want to reduce people's need to rely on self-advocacy, because it takes so many emotional resources to be able to do that effectively.
That's right. And that's what I can see is the great thing about this project, is that it's going to give capacity to those people that need to see those professions, and it's going to give them that, what I said before with and let me see it in my notes, it's removing barriers and supporting equality across the whole of society, so this community can thrive. And that's what my idea of allyship is about.
So Better Lives is the big deal, and boy, is it a big deal. I am
It
so
is a big deal.
excited by every part of the project I get to see. But are there any other particular projects you'd like to highlight while we're having this conversation?
Oh yes, did I tell you about Interlink? It's a great program, honestly. Every person that I support here in Tasmania, I have offered this program to. It basically puts people that have a variation of sex characteristics and puts them in a peer group. And sometimes these people have never had a peer group, never been able to talk to somebody else with a variation of sex characteristics. And it happens a lot here in Tasmania because of the secrecy, the shame, isolation, not only in here, but also with how isolated our rural communities are. So having a program like this, and I keep saying the program, but it's basically a 6-session program, which is run by people that have had specialist training in intersex to be able to support. And I tell you what, the person that's actually made this is on here tonight, so I'm trying really, really hard to remember everything. Hi, Bonnie. Um, but it's a 6-session program that runs over 11 weeks. There is a one-on-one support as well as group support where you actually get to talk to other people with similar bodies to yourself. And I think that's invaluable. It's something that everyone that has not had that connection to the community really needs. Yes.
I think
Also
what
gave a couple of these to my to the Department of Health down here in Tasmania to say.
I think one of the really exciting things about Interlink is it's a much more sustainable model of intersex peer support. It doesn't require volunteers working indefinitely in that traumatic environment. It is like these one and done programs, which you can get discrete funding for. So like you can say, I don't know how much the program costs, but if the cost of the program is $50,000 to run it.
It's free at the moment.
Oh, but in terms of like the cost to
Yes.
run the program, like
Yeah.
whatever the unit cost of that is, you can say like for this amount of money we can run this program X number of times, and we can do that in hospitals, we can do that in community groups, we can do that, and that ends up becoming a much more sustainable model than just again like the sort of current model where volunteers really just put everything they have into the peer support space indefinitely.
Yeah. And that's how we get a lot of burnout
Hmm.
within the peer support space. This program,
It's a game changer.
well,
We're
not
big
only
fans,
that,
buddy.
not only that, but people can do it again and again and again. It's not just a one-off, which I think is really important. But having people in, because I do run a peer support group, having people that have gone and done this program and then come back into the peer support group, it's easier. I don't know if that's the right word, but it works. Oh, we've got like 11 things in the chat. Yes, I'm about to go with the acts as a warm referral, and I'll be with all of my professional learning packages that I'm rolling out. When I actually do facilitate these packages, I'll be explaining what the warm referral process is and how this supports the community with this program. I'm hoping to talk to a couple of you people in the government. Oh, hi, Katie. Um, about seeing if I can talk to the health department about some funding or for places for this once the funding runs out currently. So then we can have funding in place for people that are from Tasmania to be able to do this program. I just noticed someone. Okay, so any other questions?
Yeah,
Oh, yes,
so I think
you've got a few. You've got a few.
I think we've talked at end about why organizational support is important to these
Mm,
projects, but I think, and this is a really interesting question to me because, like, my background working with AGA is working with an LGBTQ organization to build that, like, intersex allyship, and so
mm,
that's also been your trajectory with working it out. So
mm.
I guess like the big question that we tackle with, which is sort of like the fundamentally existential question for activists like us, is that whether or not LGBTQA plus organizations can represent the intersex community and how they can do it better. So, do you have any thoughts about that?
How can they do it better? Okay, well, they need to listen to start with.
Mm.
um, I've actually just got single words down on this particular one. Um, I might expand. And when I say listen, um, they need to hear what the issues are from the community. If someone's sitting in a chair in a position where they wouldn't otherwise be, and they're saying this is an issue, they need to listen. They want good allyship. And I'm not just talking about LGBTIQ plus organizations, I'm talking about government departments. I'm talking about anyone that wants to have a relationship with the community. They need to listen. They need to understand what the issues are. If somebody is saying, this is the definition we need to use, then you use it. You don't just go, oh, well, this organization over here that has no one in there that's intersex has said this. No, that's that's a no. So listening, it's really important. Research, understand. I mean, there's listening to what the issues are, but there's understanding why those are issues. So researching, if an intersex advocate says, well, because of Mr. Money or Dr. Money's research, this is why we have an issue now. Instead of going, huh? Maybe you should research who Dr. Money was. Maybe, you know, that would actually help you understand why there's so many issues now. And learn, so, because there's a difference between listening and learning. Learning is actually putting what you've heard into a construct that you can actually understand and learn from. And share opportunities. So if you are an organization or something, a company, and you have an opportunity that's going to help support the community, you give them that opportunity, whether it's a chair at a table, whether it's a chair at an event that they can't afford to go to, whether it's um, doing something so the community is visible and has a visibility, because when there is visibility, less is hidden and it's harder to hide a
Mm.
community when they're visible. So creating that opportunity and share those opportunities to be visible and be consistent. So not, 1 year, throw a huge amount of money at something and the next year go, well, sorry, we've got a different perspective to look at. Or, yeah, consistency, because as people from a community that has a lot of trauma, not having consistency is going to re-traumatize people because the trust is not there. So for the community to be able to trust that organization or company or group, there needs to be consistency. So I think I had to count again. Those five things to do better
Mm.
are really important.
I like how you differentiate between listening and learning because fundamentally what you're drawing a highlight to is valuing intersex experience, valuing intersex voices in this space. It's exhausting to have the same conversations over and over again. There has to be like a process of internalizing and activating around what that information is. And it's not just like valuing in terms of the authentic voices, the lived experience, but it's also just like financially valuing it to make the work sustainable.
Yeah.
It seems so shallow to talk about money, but in a very fundamental way, it is the foundation of sustainability for all the work.
Well, if you're not being paid when you're standing up for a community, then you can't eat. It's just that simple, or you have nowhere to live.
That's a beautiful
Uh,
way of putting it.
I've been there. I've actually stood up for the community so much. I was couch surfing
Mm,
for quite some time last year because I couldn't do enough work to work that fed me and put a roof over my head because I was asked to do so much for the community which I wasn't paid for.
mm,
So I continued through that because I knew there was light at the end of the tunnel. But the thing is that not everyone can do that. Not everyone has great friends that let you sleep on the couch. So you can continue to stand up for the community every day.
mm.
Yeah.
I think the both of us are also overlooking something even more basic and fundamental to to the work we do, or the work I've done and the work that you do, and that is hire an intersex worker.
Yes. Oh, yes. Oh, I didn't read that one. I actually wrote that down. Hire an intersex person to work in your organization. It's a no-brainer, really.
Mm,
I should have put it in bold, but yeah, clearly, yeah, hire people that are part of the community.
mm,
Um, I mean, I don't know, about 18 months ago, maybe 12 months ago, I said, something on one of these forums that I was invited to. I said, I don't know if I should be here. And I think it was either Cody or Gabriel said, no, 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 you're part of the family now. So,
that
I
sounds
think
like
I
something
think
I'd
I
say.
think you also said um, something very sweary about my attitude of not belonging, but it was beautiful and made me feel as though I belonged. So hire me, or better still, hire someone that can do the job that is of the community. That's helpful. Yeah,
But it
very
really
helpful.
is, you have to put your money where your mouth is, and if you've got the I in your LGBTIQ, um,
Mm,
you need to be paying an intersex person to do intersex work. It's really that simple.
it is that simple. And I mean, if you want to use the I, if you've got a committee of some sort and you're calling it an LGBTIQ committee, make sure you got that I. Make sure it's represented.
Mm.
And also, if you've got an organization that has the I in there, make sure it's represented. Make sure that you're hearing those voices. Make sure whoever it is that is that voice is someone that has the connections to the community, so you can get the whole voice, not just an individual partial voice, but a holistic voice. So the whole community is heard. I think that's really important.
Well,
I'm sharing an office.
I feel like we're sort of drawing to a close here. So, in sort of like in recognition of today being Intersex Day of Solidarity, the question I'd like to end on is: what are some everyday things allies can do to show solidarity with the intersex community?
Hey, did you know that I didn't actually put any dot points down for that? But what are everyday things? Buy an intersex person a cup of coffee and listen to them.
Mm. I
People won't
often
be
joke
heard.
about legislation needing a $50 in a back rub clause.
Yeah. I mean, if you want to spend some time learning, as I said, even you don't have to be an organization to listen. To be an ally, just an everyday ally, listen. Um, I was waiting to go into Government House, I don't know, 2 years ago, to talk to an MP. And I used to smoke, don't smoke anymore. And I was having a smoke out on the lawns, which you really shouldn't do, but I was. And there was a cleaner that came down and had a cigarette next door to me. And she goes, "Well, what are you here for?" I said, I said, "I'm here to talk to some MPs about intersex issues." And she said, "Well, what's that?" And I spent 5 minutes sitting down with someone, having a chat to someone that's never heard of that language. And in the end, just 5 minutes, she goes, "Yeah, we really should ban anyone touching a kid under a certain age for cosmetic surgery. It's not like they need rhinoplasty." And um, all it takes is 5 minutes. Have a chat. I think That's a really good way to show solidarity, just listening.
Mm.
Oh, and if you're in an organisation and you just want to be an ally, suggest maybe at a meeting changes to policy and procedure to make sure that there's adjustments and supports for anyone that needs them. Because when we look at the intersex community, they have a high need for, statistically stating, a higher need for medical leave. Yay. Well, change your policy. That simple. That's something they can do as an ally.
I think there's also like a cultural competence in terms of
Oh,
recognizing,
yes. Sorry, all of that.
yeah, recognizing our flag and
Mm.
recognizing, Intersex Day Awareness Day and Intersex Day of Solidarity.
Well, yes, definitely. The allyship of the days, which are more seen as performative allyship, and not that I'm against performative allyship, but it's not really deep. It's sharing a post, going, well, look at this. I got 17 likes for this post. Sharing that it's Solidarity Day. I want something deeper from allies. I know that sounds a bit harsh, demanding of allies, but I think allies can do more than just share a post.
And of course, the Darling Award is called that because
It's we're darlings because we do so much. But I mean, as an ally, you could perhaps sign the Darlington Statement, affirm it, and read it before you affirm it, and maybe print it out and throw it on the lunch table.
it comes back to that listening and learning thing. It's not enough to
Yeah,
just like sign the Darlington Statement and call yourself an ally. It's about
right.
how do you help us implement it.
Yeah, it's that implementation. It's what's that other word I used? They were really good. Upstander allyship. That's something I'm really into. Upstander, as opposed to bystander.
Yeah.
Upstander is something that goes, yep, okay, this needs to be done. Let's do it.
Have we actually talked about the Darlington Statement tonight?
Oh, have we?
I don't know. Would you
I've
like to do the
mentioned it.
honors?
Well, I've mentioned it several times, like
Yeah.
different statements. And now that I'm put on the spot, do you think I can remember anything? No, nothing. Nothing comes to mind. It's blank. Let me just drink my water.
So the Darlington Statement was produced at the first Darlington Retreat, which was a group of a few dozen intersex activists coming together to create a list of what are the like advocacy priorities are right across Australia. So it's designed as a living document. At the second Darlington retreat, we created the affirmation statements that allows allies to like put their support to the document, and we also created supportive statements at the third Darlington retreat, recognising intersectionality in terms of climate crisis, Aboriginal rights, refugee rights, and it essentially it is the document that has formed the basis of the Darling Award. It's the Darling Consortium, which is a group of allies and activists who have come together to sort of like to acknowledge organisations that do go that step beyond just affirming the Darlington Statement and like taking actions that support the community. So, in a very
Absolutely. And
fundamental way, it's why we're all here tonight, and we
yeah, that's
probably
right.
should have led with that.
I don't know if you can see that, but that is actually a table. It's terribly formatted because it hasn't gone to my graphic designer as yet. But in the first column, I don't know if you saw it, but there's points, and these are from the Darlington Statement. And this is what I teach. So, for example, point 44, peer support must be integrated into human rights-based, multidisciplinary medical approaches, teams, and services. And so I have a best practice that goes with this and also aligns with professional standards. So peer supports are utilised when a baby is born with variations to the sex characteristics through a warm referral process. So that's an action a midwife could take that affirms that point in the Darlington Statement, but it also affirms quite a lot of their professional learning, professional standards, I should say. So when we look at that, we can see that the Darlington Statement can be used in every workplace, every medical place, every education place, and actions can occur that support that Darlington Statement. So every professional learning package I create is based in the Darlington Statement. And I think it's really important for people to understand just how integral the Darlington Statement is to not only my projects, but it should be integral to other organisations that claim to have that I as one of their letters.
Really is that systemic and granular approach that sort of like makes a lot of these projects we're working out so exciting, I think.
Mm.
Well, thank you for having this conversation with us tonight. Thank you for going over all the work you do and talking about allyship. It's really, really vital to our work because as we've been saying, it simply takes the voices in the space and lifts them up. It makes us bigger than we are, allows us to do more than we think possible. At this point, I'm happy to open up to questions if anyone has any questions or comments or reflections. But at this point, that brings us to the end of the webinar. Thank you.